Hey, it's Kate with Cake Parenting here, and today we're talking a little bit about exercise and pregnancy and why it's really important and how we go about that. Okay, so exercise in pregnancy is really important, and it's something that we often get questions about. So definitely worth discussing today. Exercise and physical activity while you're pregnant is really important for a lot of reasons. First of all, it can make you feel better. So you can sleep better. It can help with nausea if you're experiencing that nasty side effect. It can help with low back pain. It can actually reduce low back pain if you're having that as a symptom of pregnancy. It can help you to avoid constipation, and definitely it can help, and it will help prepare your body for labor and delivery. So really good reasons to kind of motivate yourself to keep active during pregnancy. The thing is, you just have to keep a few things in mind. What I recommend basically is just whatever you do, whatever you think you want to do to stay active and fit during pregnancy, ask your OBGYN. In one of your earliest appointments, say, hey, I'm planning on, going to spin class or going to swim or do these things. And they'll let you know if you have any issues or at any sort of high risk, and there'd be a reason to not do that. So if you have had preterm deliveries in the past, or if you're at risk for them, if you have any blood pressure or blood sugar problems, for example, these would be reasons you might have some modifications. Or if you're having more than one baby, if you're pregnant with multiples, you might have some modifications. In general though, most women that are pregnant with one baby and healthy, then they can really be active and stay fit and have really very little changes to their activities. So one thing to remember is when you're pregnant, your body's already working hard. You have a lot more blood volume that's going through you, and your heart's already beating faster. So even at rest, your body's acting a little bit like it's exercising, right? So we need to make sure that we don't overdo it, and you really listen to your body when you are being physically active. In general, you want to avoid any kind of twisting, jarring, jumping motions, and any contact sports. We want to avoid those. After about 12 weeks or so into your second trimester, you definitely want to avoid anything where you're laying flat on your back too. So we don't want to do those activities. Generally, we want to stick to activities we did when we weren't pregnant. So we don't want to pick up something new and try that. That could add additional stress on our body. Yoga, swimming, and walking are usually pretty good activities. And if you aren't really fit going into your pregnancy, or there's an activity you haven't been doing, then starting slowly, doing just a 10-minute walk, for example, and building it up could be just fine and could provide you with a lot of help as you go forward. So keep those things in mind and use your pregnancy as motivation to get moving rather than, oh, I'm not sure if it's okay, so I don't want to do it. Definitely good for you, good for your baby. Stay hydrated and stay cool. You might find that you get a little bit warmer, you're sweating more, you feel hotter, and pay attention to that. Dress coolly. If you have to leave a room, if you're in an exercise class or something, go ahead and just take a break. Leave the room, leave the space, and cool down. Pay attention to your hydration levels, of course. And if you have any symptoms of, dizziness, you feel a little nauseous, or you feel faint, you have any cramping or bleeding, anything like that happens, you of course want to stop right away doing that activity and let your provider know. But again, in general, if you're healthy and you're having a healthy pregnancy, get out there and stay active and exercise. Thanks again, and if you have any questions or any feedback for us, we love to hear from you. Send us a Facebook message, tweet at us at Cake Parenting, and we'll see you next time.